Some of these events
Well, good
are
morning,
just.
everybody. Thank you so much for joining us today. I'm Congresswoman Jennifer Wexton. Welcome to this important town hall and an update about COVID relief. And before we begin, I want to wish a happy Diwali to all who celebrate the holiday. I'm very honored to be joined today by Virginia's Secretary of Finance Aubrey Layne and Delegate David Reid, who represents Loudoun County. They have been working around the clock responding to to help our community respond to the coronavirus crisis. Before we begin, I do want to start by thanking every Virginia 10 resident who exercised their constitutional right and voted in last week's election. Whether you voted early in person, by mail, or in person on election day, whether you voted for me or not, thank you so much for voting. Democracy works best when everybody participates, and our record-breaking turnout shows that more people than ever participated, and I think that's fantastic. I'm honored to have been elected to serve for a second term. I will keep fighting in Washington for everything that matters to our communities, which right now, the most important issue facing us is COVID relief and beating this virus. COVID cases are rising in every locality in Virginia 10 right now, and in the US as a whole is breaking daily records for cases. Please be safe, stay vigilant, practice social distancing, get tested if you're sick or feel that you may have been exposed, and wear a mask. I know it's tough. We've been in this for 8 months and we all want to get back to normal and go and see loved ones, especially during this upcoming holiday season. But it's not behind us. We've lost more than 240,000 Americans to COVID-19, and we all have to do our part to keep our families, friends, and neighbors safe. Now, I want to start by updating you on new guidance that the governor issued just yesterday. Beginning Monday, all private and public in-person gatherings, both indoors and outdoors, will have to be limited to 25 people. That's down from 250. That's the current cap. So that's a pretty big reduction, but we need to get this virus under control. All Virginians aged 5 and over are required to wear face coverings in indoor public spaces. Previous guidance had only required that for Virginians aged 10 and over. All essential retail businesses, and this includes grocery stores, pharmacies, must adhere to statewide guidelines for physical distancing, require that face coverings be worn inside of them, engage in enhanced cleaning and things of that nature, and that's going to be enforced by the Virginia Department of Health as a Class 1 misdemeanor for failure to do so. And sale of beverages, alcoholic beverages on premises at restaurants, breweries, things like that must end at 10 p.m. every day. So in Congress, I'm fighting to get another critically needed relief bill signed into law. This is something I've been fighting for since May when we passed the HEROES Act in the House. Now, unfortunately, our colleagues in the Senate didn't feel the same way, and they decided to adopt a wait-and-see approach while the programs expired and the virus continued to rage on. It's very clear that more needs to be done. Our guests can speak as to why it's so important to Virginia and our localities that we get additional resources out as soon as possible. In the House, we've been very clear that we're very open and willing to negotiate. We passed a trimmed down version of the HEROES Act in early October with targeted relief for families and small businesses who are hurting the most. But the Senate has shown no interest in actually tackling the real issues that this crisis has brought on, like establishing a national testing strategy, expanded unemployment insurance, or helping the growing number of Americans who are going hungry right now. Like I said, I'm going to keep fighting. I've called out leaders in the Senate and the administration for refusing to take meaningful action, and I'm going to continue to push our leadership in the House, in our own House of Representatives, to feel the urgency that I feel from all of my constituents who have gone too many months without additional relief. I'm looking forward to taking your questions, and at this time, I'd like to toss it to my guests to briefly introduce themselves and talk a little bit about what's been going on in their respective worlds. So let's start, and thanks again for joining us so bright and early on a Saturday morning, you guys. I appreciate it. Let's start with you, Secretary Layne.
Well, thank you very much, Congressman Wexton. It's glad to be here today, and I first of all want to thank you for all the collaboration you've done with the congressional delegation and working with the governor and the General Assembly as we try to get through these pretty difficult and unusual times. As the Congresswoman mentioned, I'm the Secretary of Finance for the Commonwealth. Previous to this, I was Secretary of Transportation. I know there's maybe a couple of questions in that regard, so I'm I'll be happy to answer those questions too as we go forward. But primarily, we've been working with the budget and our General Assembly members almost for the better part of a year, because this is the normal time we would go into a budget process. But of course, we've remained in that because of the pandemic's impacts on the Commonwealth with the closure to some of our businesses, which has resulted in us having to reduce some of the projected revenues that we expected to support services here in the Commonwealth. The good news is we've had a great relationship, I said, not only with our congressional delegation, but with the General Assembly members. Really do appreciate the CARES funding, which I know we'll talk about a lot later, the stimulus funds. That's been a great help in helping getting relief to businesses, small businesses, and other citizens here in the Commonwealth. Certainly the fiscal and monetary programs that came out of Washington, thank you again for that. That has helped to sustain it. But we're still in the middle of this pandemic, and we know we've got a ways to go. The governor has always said if we're going to get our economy back on track, we first got to get a resolution to this the pandemic. That's why these new restrictions and as we wait to get a vaccine. So hopefully that's not too far down the road. But we remain ready here in the Commonwealth to work with you, Congresswoman, and our General Assembly members as we work through the impacts financially. But the main issue is to make sure we continue the services and the monetary flow to citizens, school districts, localities here in the Commonwealth to be able to weather these impacts from the pandemic. So look forward to being on the conversation today, and thank you for having me.
Thank you, Secretary Layne. Delegate Reid, tell us a little bit about what you've been up to.
So thank you, Congresswoman Wexton, for having me this morning. And so for those of you who don't know me, I'm Delegate David Reid, and I represent the 32nd District, which is the eastern part of Loudoun County. I currently serve on the House Appropriations Committee, the House Transportation Committee, and the Privileges and Elections Committee. So all of those things have really been right in the middle of trying to be able to address issues related to COVID-19. As Secretary Layne has pointed out, we finished up on March the 12th with a very good budget that was ready to move forward. And then, of course, on that same day, we then had the governor issue the executive order declaring the state of emergency. And through that time frame, from March 12th onward, kind of everything has changed. I know that for myself personally, I've all of a sudden had to learn a whole lot more about epidemiology and virology and the impact that these things are having on people's lives, as well as the entire testing supply chain process, which was very difficult for us as a state to be able to kind of get a grasp of, because again, as Congresswoman Wexton pointed out, there was no national testing strategy, and there's still none exist. So what ended up happening is that we had states being pitted against each other to be able to try to actually get testing supplies to be able to take care of our citizens. One of the things that I know that Secretary Layne pointed out, and it really kind of sticks with me because it really kind of shows both the employee and personal family toll, as well as the business toll, and what has impacted the budget, is the fact that at one point in time, he had reported to us that there were 160,000 small businesses in Virginia that were operating at a reduced or minimal capacity. And in his estimation, based upon how the economy was changing and how the COVID-19 pandemic was affecting these, that it might be only 30 or 40% of those might not be able to recover. And that's the reason why it's been so important to get that CARES Act funding that you've been able to advocate for at the federal level, as well as the PPP loans, because those type of things allowed those businesses, some of them, to be able to continue to operate. And likewise, and I think the number is probably north of a million unemployment insurance claims have been processed right now. And that in that instance, those are the types of things where each one of those things is an individual, a family affected, and children being affected, and all of those things. And my office has been working very closely with the Virginia Employment Commission to be able to help to facilitate those claims. Because in most instances, the VEC is able to process those things in a timely manner. It's the ones that become the anomalies where something happens because of either where they work or how something was reported that they require our input and our ability to be able to help those along. And so that just really kind of highlights some of both the personal and the employee and the business impacts that COVID-19 has had. And then because of that reduced revenue coming into the state, it's meant that we've had to make some very difficult budget decisions, because we had a really good budget when we finished up on March the 12th. And I've said to folks that we have the budget is about priorities. And as we started moving forward and had less money to deal with, we actually had more priorities because there was greater need. And so we had to make some very difficult decisions. But I'm very proud with what we were able to come out of the special session with, because, and I know that we'll talk about that a little bit more in the questions, but I think that we made the right investments right now to be able to address the immediate priorities to help people and to help businesses, and then also to put some investments in place for future things like being able to expand broadband access across the Commonwealth. So thanks again for having me here with you today, and I look forward to the questions.
Thank you, Delegate Reid. Now, as you know, I'm an alumna of the Virginia General Assembly, and so I know that here in Virginia we have to live within our means, right? We have to balance our budget every cycle, and we can't engage in deficit spending. So I guess for both of you, if you could just talk a little bit about how Secretary Layne, about the revenue reductions that we've faced, and then Delegate Reid, kind of what you did and what you've done to make decisions about where you make those cuts, what you're doing to make those cuts. Now, I guess for you guys, it's a little bit different because you knew that you were getting the CARES Act money as of May of this year. And so you were able to factor that into your equations, I would imagine. But Secretary Layne, if you could talk a little bit about how you make those assessments of revenue that's coming in and what you're going to be able to do on the receipt side versus the expenditure side.
No, thank you. And that has been a primary focus of my staff over the last year, is what we could expect in revenues. As Delegate Reid pointed out, the economy was strong before we went into this. I'm not suggesting that there weren't some things we could do better, but overall the economy was strong. And that has helped us a little bit as we've gone through this impacts of the pandemic. But as we had the General Assembly had just signed off on a budget package in late March, mid to late March. And of course, that's when the pandemic hit. And at that time, we had no idea how significant the ordered shutdowns were going to have on the economy. And so what we chose to do at that time is to, one, suspend all new spending. In other words, protect the current budget. It may not be exactly what everybody wanted, but at least the core services of the budget were protected. Making sure we got money to localities, to school districts, to others. They would have some surety that we weren't going to try not to lay off individuals at the state in order to be able to support those extended services or expanded services that Delegate Reid mentioned. So that was the strategy of the governor. We cut all new hiring. We suspended all discretionary spending and just focused on making sure we were doing the services that were necessary to support the health and public safety officials as they tried to respond to this. And so that was the strategy from our standpoint. Now, the other thing it did is it gave us an opportunity to see how this pandemic was going to hit Virginia. And I can, at least from an economic standpoint, and I can report we're somewhat of an anomaly. We have held up better than many states. For instance, we've not had to have additional borrowings to meet our base budget obligations, like many states you'd read in the paper are having to do. Not that it's not been impactful to many businesses, and we understand that, but our reliance on the federal government for defense spending, our large employers like Amazon, Micron, our tech industry, those industries that could work from home, not everybody could, have held up fairly well. So we now have a better idea that, yes, our revenues are going to be reduced, but maybe not as much as we thought. Now, I don't want to minimize those people that have been impacted, and that is Main Street businesses, the hospitality, the restaurants, the leisure industries. We've got to pivot, and we've started to already do that, which we can talk about a little later, in helping them get back on their feet. So just because we're not being as impacted as much, I don't want anybody to think that that doesn't mean we're not just as aggressively looking at helping getting those small businesses and those industries back on their feet with programs both from the federal government and from the state, not only using CARES funds, but some of our own general fund monies that the General Assembly has appropriated for us to use. So overall, Congresswoman, that was our strategy. It looks like it's worked. We've been able to maintain the current level needed to address this pandemic and the closures from it. We've been able to administer a lot of the federal funds, added some of our state funds. Delegate Reid mentioned broadband, but certainly there's been money to K through 12, to higher education, to healthcare workers. And so very fortunate that the resilience of the Virginia economy has been able for us to do that. But we've got a long ways to still go. There's still a lot of uncertainty until we get a trusted vaccine, which I hope is not too far away. We're still going to have to rely on mitigation efforts, such as the governor mentioned yesterday, to try to control this and really not overrun our healthcare system. But we are in better shape in getting PPE. That's one thing Delegate Reid mentioned. That was difficult at first because we had to make our own supply chains. But overall, we've been able to respond without significant reductions in service that was needed to respond to the pandemic. And we're just going through another reforecast of our revenues. Hopefully, we've seen a pretty good rebound in our up through September. That will continue, although I think it'll be sluggish. And hopefully we'll be able to add additional revenues for the General Assembly to consider in not only helping this, but some of the priorities we've had to put on hold. So that's been our overall strategy. So far, it looks like we've been on track. And with that, I'll turn it over to Delegate Reid from the perspective from the General Assembly.
Thank you, Secretary Layne. I would just like to highlight one of the things that he was talking about the strength of the Virginia economy. So through the McAuliffe administration and then the Northam administration, by the time that we were looking at COVID, the COVID-19 pandemic hitting, our unemployment rate across the state was about 2.6%. And then as we got into the worst time period, it jumped up to like 10.6%. So, I mean, it was really a significant increase and a lot of people being put out of work. I mean, now, because as Secretary Layne said, we've started to see some degree of recovery. So we're back down kind of in the mid sixes range, which shows some progress. But the problem that we're now seeing with the governor's order yesterday and a rise in additional COVID cases, as well as we start to move into the winter months, all of those restaurants and those hospitality groups that have been seeing a little bit of recovery over the summer are now probably going to be adversely impacted again, because it's much more difficult to go and dine outside when it's going to be 30 degrees or 20 degrees outside, and now we're having a spike in COVID-19. So we know that's one of the things that both the Secretary and, of course, the General Assembly is looking at, is how we are able to kind of help those businesses and those industries be able to maintain and be able to be on a path to recovery. Now, one of the other things that I know that you had asked about, Congresswoman Wexton, was kind of how we in the General Assembly and the Appropriations Committee went about looking at and making decisions. It's important to point out that this was a special session, and it was really intended only to address some of the things that were related to COVID-19 impacts on the budget and not do a complete review of the budget. So the chairman of the Appropriations Committee, Delegate Luke Torian, and Speaker Eileen Fillicorn had given us some priorities. And these were the things that really tried to bound what we were looking at. And those priorities were K through 12 and childcare, higher education, healthcare, including mental health and disability, developmental disability waivers, as well as housing, evictions, utility disconnects, broadband, all of those things that are affecting people's lives on a daily basis. And then because, of course, there were a whole lot of actions that occurred over the summer related to criminal justice reform and police reform, that was also a priority as well. So we had a fairly short list, but it's also a fairly extensive list because it touches really kind of the lives of just about every Virginian in the Commonwealth. And so that's how we went about prioritizing what we were going to focus on and where we were going to take the analysis that the Secretary's office had done and add money back in, because those were going to be the critical areas that we thought were going to be most impactful to people's lives. And one of the things that I think is really important here is that as the CARES money, as more of that became available and we were able to use it, the governor actually has increased both the amount of money that's available for small business grants, so it's now $100 million, and he's also broadened the aperture so that it will now apply to more small businesses. And so that's been really beneficial, because we're then able to, when we're getting those inquiries from the businesses, is to actually point them in the direction of that Rebuild Virginia Grants program. And that's just been fantastic. And that is the funding for much of that is coming from the efforts that you had in Congress to be able to get that money to the states.
And once again, that money needs to be allocated or spent by the end of the year. So as you guys are moving forward, I know that you're just coming right off of this special session and you're preparing for the next session, which starts in early January, I guess, right? You're having to come up with the next biennial budget or the next budget. I guess, is it a biennial or is it no, it's a caboose this year.
That's correct. Right? Yeah. One more year left, and making adjustments to the 2-year budget that was passed just recently in March.
Okay. Yeah, sure. Are you hoping or expecting that you'll get more federal relief, or are you looking at the worst case scenario right now when we move forward?
From Congresswoman, we would love to have more federal relief, but we are not counting on it, at least in our revenue projections. I think that's the prudent course, talking with the governor, the General Assembly, the Chairman Torian, and Senator Howe and Senate Finance. I think the best for Virginia is to determine what our revenues are if we get additional federal stimulus. Hopefully, a lot of it will be directed right to employers or businesses, which I think would, in fact, be the best way to get them on their feet. Of course, the indirect result of that, they'll be able to hire people and keep their profits up, which will come in revenues. But we have not planned on that. As you know, the first round had to be used explicitly for COVID-19 impacts. You could not use it for replacement of state revenues. So that being the case, we weren't sure where the second was going to go and did not anticipate that would happen in terms of our revenue projections going forward. But as I said, any efforts, and I know you have been an advocate for this, greater flexibility with those monies, the ability to extend the deadline. Although, as we were talking before, Congresswoman, I assure you we're going to spend all those monies and not have to send any back, and not try not to be a prudent tax payer, but we can use all those monies, and we will do so in the time frame. But any additional monies would be significantly helpful. For instance, we know, I just heard the president talk about Project Warp Speed to get the vaccine. We've got a plan to get those vaccinations here in Virginia. Right now, there's no federal funds that have been allotted to help us do that. So we're having to put that sort of in our budget plans. And so anything you could do in that regard, and I know you've been a strong advocate, would be helpful. But so hopefully there'll be another one. Anything that Virginia can do to help you, please let us know. But we're not actually counting that in any type of revenue forecast.
And Congresswoman Wexton, I can echo that as well, because from an appropriation standpoint of view, we know that despite your efforts, there's a lot of other factors that go into actually getting additional federal funding to us. And as you pointed out, you've previously served in the General Assembly, and so it's important to highlight that we have to have a balanced budget. So we can't count on money from the federal government that may not actually be coming, and we also can't print our own money. And so therefore, we can only deal with the revenue that actually comes in from businesses and employees and other sources to be able to actually provide for common services for people. So we have much more constraints about what our revenue sources are. And as the Secretary said, additional federal funds would be welcome, but if we can't count on them, then we have to rely on our own revenue streams because of the fact that we do have to have a balanced budget.
Right. Exactly. And I do want to thank you guys at the state level for pushing so much of the CARES money out to localities as you did, because some states were not as generous with their localities and just kept it, mine. But here in Virginia, it was very nice to see it shared, because the local governments have really had to pick up a lot of new expenses and a lot of new obligations. So I want to thank you for that. Great. Well, I think at this point we can go to pre-submitted questions, because otherwise I'll just keep talking at you all day.
It's okay.
All right. Thank you, everyone. Our first pre-submitted question comes from Diane from Loudoun. And she says, I teach at Shenandoah University that is doing a superb job monitoring staff, faculty, and students. This includes taking steps to test, quarantine, and complete contact tracing. I'm dismayed that K-12 schools are not doing the same. How can you help all schools, K-12 and higher ed, follow the same protocols my university is following?
So that's a great question, Diane. And I am very impressed by what Shenandoah University has been able to do, and also how Frederick County and Clark County have been able to keep the virus under control there over the mountain. We haven't been as fortunate here in Northern Virginia of late, although I understand that there are increases going on in that part of the world as well now. But Dr. Green always keeps us very well informed about what's going on in Clark and Frederick. But we included money for that in Heroes. There was $100 million $100 billion for schools to meet demands of the new demands of more cleaning, PPE, distance learning, everything that they needed to do on that. And it also included $75 billion for contact tracing at the national level, to send it down to the localities for them to be able to conduct these kind of contact tracing. And that, because it has to be at the community level in order for it to be effective. But right now there is no federal strategy. There is no federal plan. There is no way for us at the federal government level to help the localities and the states with this issue. But it's something we tried to do in Heroes 2.0 and in Heroes 1.0. So at this point, I'll toss it to Secretary Layne and Delegate Reid and see if they have anything to add at the state and local level, what they have observed.
Delegate Reid.
So Diane, yeah, first of all, I'd just like to say thank you for the question. And also, I'd like to highlight the fact that both Shenandoah University and George Washington University here in, at least George Washington University in the 32nd District and Shenandoah in the 10th Congressional District, have two of the premier nursing programs in Northern Virginia and across the entire state. And I have had some discussions, especially with the folks from George Washington University nursing program. And I've just been in awe of the fact that the nursing students there are going in, doing their training, getting their work, and then going out. And those are the individuals who are going out and working on the front line of this pandemic. And they really need to be commended for their ongoing commitment, knowing that it's like when they signed up for the nursing program, it was probably just to do routine hospital stuff and not to actually be on the front line of a global pandemic. So to both the nursing students at both Shenandoah and George Washington University, I think they need to be commended. Now, as far as the testing is concerned at the K-12 school system, what was done at the state level is the State Department of Education actually created a set of guidelines that said this is how each one of the different jurisdictions should look at implementing their coming back to school. And what we have to realize is that across the entire Commonwealth, all of those different school systems are very unique. You have some in Loudoun County where you have over 80,000 students, and then you have others in other parts of the state where it's a much smaller size of the student body. And so instead of trying to mandate what were going to be the guidelines across the state, we put the guidelines in place and then said each locality use these and do the very best that you can for your particular jurisdiction, because it was our belief that you knew them the best. Now, one of the things that we've done, and we've talked about this, is that we've had to create our own supply chain for PPE. We've had to basically create our own supply chain for testing and be able to actually get that in place. And so it is an ongoing effort. I know that that was one of the greatest sources of frustration probably for the governor early on, is the fact that there just wasn't enough supplies to be able to do the testing. And you'd come to find out that it's like, okay, we have enough test kits, but we don't have swabs, and we don't have a way to get the swabs from a place to where they're going to be tested. And then we don't actually have enough laboratories to do the testing. And then when you have all of that, you find out that you need to have a clinician to actually do the testing, and you don't have enough of those. And so we have had to build out this entire supply chain across the entire Commonwealth during the last 8 months or so. And early on, I know it was a source of frustration for all of us. And I think that, and the secretary can probably speak to this, is that supply chain is probably still being built out and still being made available to the K through 12 school systems to be able to do a better job with testing. So I believe that we're on the right track, and we're just slowly catching up with all of the issues related to the pandemic and those testing issues.
Yeah, just a couple of comments to add to that. You are right, Congresswoman. We did push a lot of money down to localities to be able to help them respond more directly to specific instances and in their areas, and that did include school districts. So some localities did choose to give some of that to some of their school districts. But over and above that, from the monies coming directly to the state, $221 million was allocated through K through 12 of the CARES funding to help augment the state funds that were going in for PPE and other issues related to COVID-19. Also, about $117 million, a little over $116 million, was given to colleges across higher ed across the Commonwealth for the same purpose. So the Delegate Reid is correct. We had to start our own supply chains up in this. We're in much better shape, although we can still do better. But over and above that, we were able to take these monies that from the CARES Act and help over and above what the state was doing for every district to be able to spend on a per pupil basis what they thought was right for their district to maintain the general standards that the Department of Education and the governor had worked out. One of the things that, as an overall theme here, is that the governor has tried to use a carrot versus a stick. In other words, with this, helping people because it's in their own best interest to, like, for instance, wear masks or do the personal hygiene, not only keeping others safe, but for themselves. It's been a recent CDC study that said wearing a mask is just as important for yourself as it is for others. And so that has been the overall strategy. Obviously, we've had to do some additional things for compliance, and you saw some of that in the governor's order yesterday. But this is going to be all about public confidence and individuals feeling confident to come back, whether it's in a school or a business. And so we're trying to use that approach. I know the governor is in terms of making sure that it's not something mandated as much as it is people feeling safe because government's doing what they can on behalf of their citizens. But did want to point out there have been substantial amounts of money from, again, the federal funds over and above the state that we've allocated to K through 12 and higher ed institutions.
Thank you so much, Secretary Layne. And I guess it makes sense here in Virginia that we leave it to the localities to decide what's best for them in their local jurisdictions.
We're a Dillon rule state in a lot of respects, but when it comes to the pandemic, it looks it's very clear that something in Bristol may be a lot different than Alexandria. And we wanted to make sure not only did we have the state guidelines, but they had resources to adjust specifically if they needed to.
All right. Our next question is from Larry from Winchester. And he asks, is there going to be economic injury disaster loan forgiveness or additional funding for COVID relief for small businesses? If not for COVID, we would be doing just fine, but can't hold on much longer.
Yes, that's a great question. And this is one that I get all the time from small business owners here in Virginia 10. I haven't heard anything about forgiveness on the EIDL loans, although the grant of up to $10,000 of a portion of the loan is a grant, and so it will not need to be repaid. But on the Paycheck Protection loans, I have fought for a very streamlined forgiveness process. That's a one-page application for businesses with $150,000 or less. Paycheck Protection funds. That is the vast majority of businesses who have taken advantage of that program, and so I hope that will help them. But those funds have already been spent and have already expired. So we definitely need another round of small business relief. Heroes 2.0 included targeted relief for the businesses who were hardest hit, making sure that there were set-asides for them, for things like the restaurant hospitality business, the small businesses who were worst impacted by this, businesses who weren't able to stay open during the shutdowns and who have really been badly impacted by the crisis and the relief. Now, I know that there have been some other programs that have been pushed out at the state and local level for small businesses, and maybe Secretary Layne and Delegate Reid, you can talk about some of those, because I understand that every locality has a small business fund and relief program. And the Commonwealth has some as well. So if you can speak to some of those for Larry to see if he might be eligible or if his business might be eligible.
Sure. Delegate Reid mentioned the Rebuild Virginia program, which is eligible for any small business that's been impacted by this. That is a grant program up to $100,000. So Larry, if you've not heard about that, I know you can ask either localities or certainly call my office, and we'll make sure you get the information. But that is a grant right out front, and it's pretty much just having to verify that you have been impacted by COVID-19. Again, we did that. A lot of localities had set out small business programs, and I want to point out, this is in addition to. You don't have, just because you get it from somebody else doesn't mean you can't apply for this too. I was talking to a restaurant owner the other day. He had a PPP loan, a loan from the county of Albemarle, and he was getting the Rebuild Virginia. And that's, if you qualify, that's what we want to do to help make sure, because it appears we now know this is not going to end in the next few months. It's going to be with us. Even if we get a vaccine, we're still probably dealing with this for the next 6 to 8 months to a year. And so we've got to continue on the path we're on. So Congresswoman, yes, if we could get more relief from the federal government would help, but I would also suggest, as Delegate Reid has mentioned out, that will be a primary focus of our budget coming up. How do we help transition away from, not away from, but in addition to the health, but as we get on the other side of that, getting our businesses back on their feet. So I know that'll be a part of our budget discussions coming up, but I did want to point out the Rebuild Virginia program. And of course, if you're an individual, there are programs related for rent relief, Delegate Reid mentioned, for utility relief in that regard. So if you're a small business that works as an individual and you've had those issues, that can be something you could also address from the state's perspective.
And again, just to reiterate, the Rebuild Virginia program, and Secretary Layne's already pointed this out, this means that you, Larry, or other businesses can actually get money from your local county, as well from the state, and the PPP loan also. And it really is geared towards small businesses, because there's a $100 million pool that the governor and Secretary Layne have put into it. And it is truly for small businesses that are 250 or less employees and have, I'm looking at the information here now, that have $10 million or less in annual gross revenues. And so you can get up to $100,000 in addition to the other loans or grants that you've already received. And so it's a recognition from us on the state level that the way to be able to help these businesses be able to weather the COVID-19 pandemic, and for them to be able to keep people employed and be able to continue to pay for the rent in their facilities and maintain equipment and everything, while we are waiting for the vaccine to come along, or for us to figure out a way to be able to continue to work in this new normal. This is intended to bridge that so that those businesses can survive. Because as I pointed out earlier, we were in some respects probably an envy of the nation, with our unemployment rate being at 2.6%. And as Secretary Layne pointed out, we have such a diverse economy now that we've done a much better job of weathering this. And quite honestly, I think because of some of the actions that we took early on, meaning the governor and the General Assembly, we did a better job of being able to manage the health crisis portion of this. And so there is a hope that when we kind of start to move through this and we come out the other end, that Virginia can continue to be one of the top 1 or 2 places in the nation to be able to do business. And we can become a destination for places that are looking, that are saying, okay, who is supporting businesses, who is supporting their employees, and who has done the best job at being able to manage COVID-19, that businesses will be able to come to Virginia, and the current businesses will be able to continue to flourish.
Excellent point. So definitely look into the Rebuild Virginia grant program and check with your local, your city or your county economic development authority and see if they have any local programs as well.
I'm actually going to jump in with 1 or 2 Facebook comments that we got here because they're on the same topic. We had 2 individuals ask about nonprofit organizations, talking about the, having to cut fundraising events, and they ask if there are any state or federal programs that nonprofit organizations are eligible for, whether or not they qualify for some of those same small business grant or loan programs, or if there are other programs available.
Well, I can say from the federal level, the C3s were always able to get Paycheck Protection Program loans, or loans to grants, and we tried to extend that to include C6s as well. Associations and groups like that as a part of Heroes and Heroes 2.0, but that hasn't actually passed yet. So that's something that we will keep fighting for. But C3s have always been eligible and will continue to be eligible in the next round, which we hopefully will get.
So I'm looking again at the Rebuild Virginia program qualifications, and it's, of course, corporations, S Corp partnerships, LLCs, and then also 501c3s, 501c7s, and 501c19 veterans organizations, Virginia tribes, sole proprietors, and independent contractors. So again, over time, initially, I will tell you that and this is the reason why it's important for people to go back and look at the new criteria for the Rebuild Virginia program, because initially when the governor started it, it had a much more narrow aperture because we weren't sure how much was going to be needed, and we weren't sure how much federal funds of the CARES funding that we could use towards it. But then as things progressed and we started to realize that the money was not being taken up by those really very small businesses, the governor expanded the aperture, expanded the size of the grant application, and made it available. So I really would encourage all of those organizations that I named to go and look at the Rebuild Virginia website, and there's an application process in there as well. So yes, those nonprofit type of organizations are eligible.
They are. That is correct. And also, I'd point out that includes houses of worship. We have had work with the Attorney General. They will be eligible for these funds. And over and above the higher education funds that we provided to public institutions, we've also done that to private institutions, higher education. So typically those are things that are not able to get state funds because of our constitutional laws, but based on the way the CARES Act was done and the response to this pandemic, we're able to provide that to houses of worship in the Rebuild Virginia, and also we've made direct monetary help to private schools, so higher education private schools. So just want to let you know, Dr. Reid is right. I can't think of much that isn't eligible for the Rebuild Virginia program if you're organized as a business or a sole proprietor in any way, shape, or form.
All right, our next question here comes from Lena from Loudoun, and Lena asks, what measures fall to Congress for COVID-19 economic relief versus those that can be done at the state level, and where is there collaboration between the state and Congress?
So that's a great question, and really, it's an all of the above approach. I mean, it takes all levels of government and all entities to fight this virus. So in Congress, we did both with the CARES Act. We included Paycheck Protection Program and EIDL grants and loans for businesses, and that was at the national level through the Small Business Administration. And then we had state and local funding, or state funding, which we pushed out to the states to then spend as they saw fit. So there are some things that we can do at the federal level, which would be, developing a national testing strategy, getting those supply chains in order. We didn't manage to do either of those things. That's something that we're fighting for in Heroes. But we could also, push out money to small businesses through the Small Business Administration and those lending programs and grant programs. But then sending money out to the states to send it out to localities and use it as they saw fit was something that we also wanted to do, because just making sure that there's that flexibility and that knowing that states and localities know better what the needs are in their respective jurisdictions than we do at the federal level.
So, Lena, that is a really good question. And let me just give you some kind of real world examples of how my office and Congresswoman Wexton's office have been working together. So while I can help to inform and educate businesses about the the SBA EIDL loans as well as PPP loans, when they actually run into difficulties, then those are things that I will refer to Congresswoman Wexton's office, because that is a federal program. Likewise, when she gets calls from individuals who are having issues with unemployment insurance, then she will then refer those to my office if they're within my district, because that is a state program. Additionally, we have all recognized that it's like the folks on the elected school board are dealing with the issue of trying to keep both students and teachers and administrators safe, and they're doing it with actual less money. So one of the things that we did during the budget was, because of a reduction in sales tax revenue, because that is where the localities get a lot of their money for being able to help to pay for schools, we actually kept them whole by putting, I think it's $95.2 million into the budget that would go out to the school programs or out to the school districts, so that they could then actually have the money to kind of maintain what they're doing. So that's a good example of where it's like, the money comes from the federal government, the state government gets it and decides what they're going to do with it. We recognize that there is a need and a reduction in revenue that is occurring at the local level. And so, as Congresswoman Wexton said, instead of us holding all of the money at the state level, we pushed it down to the locality so that they could use it for the school. So that's where you've got like all four different levels of the government working together and recognizing that each one of those different levels do different things and have different responsibilities. I like to talk about the fact that through my time in the military, you learn to kind of respect the lanes in the road. And when there's something that's outside of your lane, you know who to give it to for them to be able to do the most effective job of addressing that problem.
Yeah, I would just mention from the executive branch side of this, who are charged with executing this, we've had tremendous support from our congressional delegation in terms of responding to requests. And of course, we look at the programs that they push down. And as Delegate Reid has mentioned, we try to coordinate and enhance those by getting them out to localities and of course, some of the programs in the state. I would say, and of course, we had a periodic, we would speak weekly there for a while. Now they're periodic with our congressional delegation, updating them and them updating us as to what was going on. Probably, and this has been mentioned before by Congresswoman Wexton, the area from a pure execution standpoint that was difficult to maneuver through was the executive leadership coming out of the president's office in terms of PPE procurement, coordination, and testing. And not trying to be political at all. It just was a fact. All the states had to deal with this. And that could have been better coordinated across the country. And I think, given us a little better way to maneuver to the point we are now. Hopefully, we'll see more of that coming out because we really were competing against states, other governors, and I call out my counterparts, and they were trying to get the same amount of PPE we were, or trying to get testing, and where do we get test kits? And so if that would be coordinated, I think you would see a much better coordination across, although I think we've done a pretty good job working with Congress in this, but hopefully as we move forward, we'll get a little better leadership in terms of, again, just getting the materials and understanding what the distribution of those are going to be so that we can make plans to help our citizens the most effectively.
Our next question comes from Melinda from Sterling, and actually we got a question in the Facebook chat that was very similar to this. But Linda says, I've heard a lot about cuts to Virginia's budget that would impact things like teachers' raises and such. Can you talk about what cuts have and will need to be made and how that could impact jobs?
Well, Congressman Wexman.
I'm going to toss to you guys on this because it sounds like it's a state issue. And I know that you said that you cut all discretionary spending, and I assume that teacher raise was one of those things. Yeah. But I guess there could be some more impacts, and I'd like to hear them myself.
I'll defer to Delegate Reid, but just give a couple of overall comments. Yes, there was about $2.7 billion of new spending over and above our base budget that was passed by the General Assembly. And of course, teacher raises were in part of that. And then of course, the impacts of the pandemic hit, and we had to freeze all the new spending, although we had no cuts. So I'm not aware of and don't foresee any cuts to any programs like teachers pay currently or locality distributions or anything that. Our strategy has been to maintain the current base, although we would love to add more had we had the revenues. One of the things the General Assembly has done is add in a bonus for teachers and other state employees if revenues come in at a certain level, and it appears we're on our way to doing that. But in terms of actual cuts, physical cuts, or to localities or school districts, I don't believe that is going to be necessary, not in the cards. And we've really tried to, Delegate Reid mentioned some of the increases that we're anticipating with the new gaming revenues. That budget amendment is going to help actually put a little more in there than last year, although not as much as we'd love to them to have had all things being equal. So I don't know of any cuts. There's some lost opportunities in increasing pay that I think we're going to have to delay, but not aware of any cuts that we're anticipating. Delegate Reid, I know you're on appropriations and y'all appropriate it, but I think that's where we are.
So yeah, I would agree with you, Secretary Layne. And one of the things that's important to understand is just that right now, even though things are looking better, we're still in an era of kind of uncertainty about what the budget is going to look like as we go into the rest of the biennium and that fiscal year. Because it's important to point out that it's like when we're doing employee raises, that's a recurring expense that has to occur every year thereafter, because you can't say, okay, I'm going to give you an increase of 2% this year, but then I'm going to take it away next year. That's just not feasible. And so there are times when we can supplement income with a bonus because we have additional revenue that is non-recurring, but then we can't actually do recurring. Now, going back to the early in the discussion, Secretary Layne had said that had pointed out that we had actually frozen any additional expenditures. That was the unallotment that had occurred, but that was in an effort to prevent any type of layoffs across the entire governmental spectrum. And so that was kind of the initial goal, to be able to keep everyone's jobs, because there's a lot of people in the Commonwealth right now who are not working, and that is what has resulted in those over 1 million unemployment insurance claims. So we were trying to actually do no harm, any further harm in the state budget. Now, going forward, and I will tell you that there has been a commitment from both the House Appropriations Chairman, Luke Torian, as well as the appropriators, that there are some long-term kind of systemic institutional issues with pay across the entire spectrum of Virginia, whether you're talking about teachers, correctional officers, Virginia State Police, that have now become our responsibility because we're in the majority, and we need to be able to address these. And we are committed to making those changes, because we did have in the budget that we had to then unallot that money. We had an increase in there for teacher raises. We had an increase in there for the Virginia State Police. We had increases in there for other things. And we had to pull back all of those things because we don't know there's so much uncertainty about what is going to be the recurring revenue that's going to be coming into the state. As we get more fidelity with where that's going to be, then there is a commitment from all of us to be able to restore those things and get those raises and increases back in there where they were before.
And I would just add to that, as far as teachers are concerned, and how, and whether there would have to be cuts in that area. One of the concerns that I have, I'm glad that the state is in a do no harm and has triaged this and is not making any cuts. But because of the composite index and because of how state education, how the state funds local education, just for those standards of quality positions and for jurisdictions like we have here in Northern Virginia, where the state actually funds a smaller portion than the locality does for our local education, I am concerned about the revenue losses from the localities and as well as the additional expenses. So one of the things that we were trying to do with CARES and we trying to do with Heroes as well is to push money out to those localities, to those specifically to K through 12 education and higher ed, to defray some of the additional expenses that they're facing, having to deal with remote learning, having to deal with additional cleaning, having to deal with additional bus routes, to keep the social distancing for kids, and all of those collateral expenses that they're facing during COVID, to free up more state and local funding to make sure that they don't have to start laying off teachers and things like that. So that's one of the things that we can do at the federal level, even though most education is administered locally.
All right, well, we're running out of time, but I think we can get one or two more questions in here. This next one comes from Manny from Chantilly, and Manny asks, what are you proposing to help taxpayers that are unemployed or have had their businesses destroyed by the lockdowns? And what specific criteria is necessary to call an end to this, quote, emergency? Also, what specific actions are being taken by the government to reduce non-essential expenses?
So we absolutely need another round of paycheck protection and other kinds of relief to small businesses. There's no question about that. That's something where we get broad agreement. And I would like to see it better targeted than the first couple rounds, which you heard about the potbellies and the big, publicly traded corporations who are getting paycheck protection who probably really shouldn't have. So I want that to go to true small businesses. One of the things that we did in the second round of COVID relief, or the second round of paycheck protection relief that went out, was we made sure to segregate a portion of that just for the smallest businesses, and that turned out to be very advantageous for them. So we definitely need another round of that. We need more of the enhanced unemployment benefits for people, because those expired, and those were really a lifeline for a lot of folks who are now behind on their rent, who are behind on their mortgages, who can't make ends meet on $367 a week or whatever it is that they're able to get from the state unemployment benefits, but still can't find a job. So we need to make sure that we're getting those benefits out there. And as far as keeping stopping unnecessary expenses at the federal level, we can engage in deficit spending. I understand. Believe me, I'm a fiscally, I am a fiscally conservative person, but right now our country is on fire, and we will not have an economy to save if we don't take measures to rescue it now. And I'm not the only one that feels this way. I serve on the Financial Services Committee. Chairman of the Federal Reserve, Jerome Powell, has come before us many times and has pleaded us to engage in another round of relief, because one of the things that caused the Great Recession to last longer than it should have was the austerity measures that were put in place, causing lots of layoffs and hampering the recovery. So if we want to mitigate the depth and breadth of this recession that we're in, getting the virus under control is job one, but also making sure that we protect those businesses so that they'll be able to come back and rehire when we get on the other side of this.
So I'd like to. It's really unfortunate that businesses have really been so adversely impacted. And I have had calls, and I have talked to some of the businesses in my district where, no kidding, they have said, I've been in business for 16 years. I've got 45 employees. If I'm not able to if I'm not able to generate revenue and pay my employees, then I'm going to have to lay them off. And that's where the things that we've done, whether it's been the PPP loans or the Rebuild Virginia grants, those are us hearing from those businesses and doing what we can to be able to actually give them a lifeline to be able to continue. In the case of the PPP loans, for 8 weeks, with the Rebuild Virginia loan, the $100,000 could actually maybe extend them for another period of time. We are very much aware of the negative impact that the COVID-19 pandemic is having on businesses and their employees. But I'd also have to point out the fact that this thing is real. And I was just looking at some stats. I mean, just yesterday, there were another 1,400 Americans that died across the nation. There were another 1,200 the day before this. We're up to 244,000 deaths. This is not the seasonal flu. The seasonal flu has a mortality rate of like 0.1%. And the mortality rate on this at times has reached up to like 4.5%, which is 45 times more deadly than the flu. I mean, people are dying. You saw the stuff up in New York City, and now in places like El Paso and Houston, they are bringing in mobile morgues. And so, I mean, this is serious. And that's the reason why I go back and say the things that we have been doing in Virginia with the actual emergency order, the mandates on wearing a mask and the social distancing and all of those other type of things have actually allowed us to be able to save the lives of Virginians and be able to put us on the right step to be able to move forward with an economic recovery, while some of our other peer states are still dealing with, the seriousness of this. And so it's a real dilemma. But I will tell you that we are committed to making sure that we create an environment where that businesses can flourish and that they can actually survive this and come back hopefully stronger than before.
Yeah, I would just add quickly, because I know we're running out of time. Chairman Powell is absolutely right. If we don't continue to provide stimulus, the stimulus that's already been provided is gone. And that would be, I won't call it wasted money, but in terms of getting us over the hump, it would not have done what it was needed to do. Like Congresswoman Wexton, I'm a fiscal conservative, and certainly we're concerned about national debt, but now is not the time to deal with it, because that's going to happen regardless of whether or not we provide stimulus or not. It's just going to take a longer time because we won't have the economic activity in that. And we are going to be in this for a while, even with the vaccine on the horizon, and let's hope it is 90% impactive. But we've been in this a little over 8 months. And if you look at the community and or herd immunity rate, if you want to use that, we're about 6 or 7% in Virginia. We've got to get to 70% or 65% so we can go back to what we might consider normal. Without a vaccine, that's going to take a while. And even if it's 90%, we've got to get our population to believe in it, because if we only get 50%, those probabilities only get us up to about 50% herd immunity in forward. So I think it is important from a financial perspective, as Congressman Wexton has pointed out, and Delegate Reid, the same thing. We have got to continue to support this, and if not, the impact on our debt and our citizens will even be greater. So hopefully, Congress, after either the lame duck session or shortly thereafter, will take this up, because I think it's in the best interest not only of our citizens, but for our national economy too.
Absolutely, Secretary Layne, and I could not have said it better myself. I mean, I certainly hope that we come to an agreement and pass another round of stimulus during the lame duck session. We're also looking at a potential government shutdown if we don't fund the government after December 10th. And here in Virginia, that would be a horrible, horrible thing for us. So we need to make sure that we make that a top priority as well. Those are my top priorities when I return to Congress next week. But I want to thank we're already at over an hour, so I know that you guys have a lot going on today, and I thank you so much for taking the time to join me here today for this town hall. And thank you to everybody at home who joined us. If we didn't get to your questions, we will try to get to them, through a response online or through another channel. But thank you so much for joining us this morning, and take care and stay safe, everyone.
Thank you.
Thank you.